70 members of the COVID recovery group, group of Tory backbench MPs, actually chaired by my next guest, former Chief Whip Mark Harper, who joins us right now. Good morning to you, Mark.
Good morning, Julia.
I'm going to say to you right now, on behalf of myself and many of my Talk Radio listeners, I'm thinking probably a majority of them at this point, thank you for providing some opposition, you and your MPs, to what the government is planning to do, because we're not seeing enough of it from other parties, that's for sure, and indeed I think within government. Let's talk about, first of all, what happened yesterday, the spending review. I mean, we've gone through the numbers there. They're shocking, they're horrible. I don't know why they are shocking to a lot of people, because everyone could have predicted this. You shut down the economy. What a surprise. It costs jobs, it costs businesses, it costs livelihoods, and ultimately, as we now know, World Health Organization reports, numerous other reports, Office for National Statistics, everyone, it also costs lives in the long run as well, doesn't it?
Yes, it can do. One of the things that we've been calling for, the group that I chair, is for the government to be very transparent about each of the measures that it's proposing, what impact each of those measures has in reducing the spread of the virus, but also what impact they have on non-COVID health harms. And I know you set many of those out on your programme in the past, and also on the economy, because if we have a smaller economy in the future, that's going to impact on resources we have to spend on the health service, to spend on social care, to spend on looking after people. And a smaller economy, less money, tends to lead to worse health outcomes. And I think what you have to do is get the balance right. It's very difficult, I accept. You're trying to save the overall number of lives possible, greatest number of lives possible. But I want to know for each measure, are you saving more lives than you're costing? That's really what we've asked the government to provide before we're asked to vote on it next week.
Well, indeed, again and again and again, MPs from your group have been asking for this information, this cost-benefit analysis, this impact assessment. We know there wasn't a proper impact assessment carried out before the second lockdown was instituted, because a cabinet minister confirmed that to me on air, Robert Jenrick. Yeah. But I mean, you were actually asking a question to the Prime Minister the other day when his line went down from number 10, where you were actually asking, could we see the actual numbers? We want to see what the cost benefit of each individual measure that is contained in these different tiers would have on saving lives from COVID, and also on what the costs are in terms of health and wealth would be. We never really found out what the answer was. Has the Prime Minister told you since?
No, we've asked the question, and we've repeatedly asked the question. The government has said they're going to publish information when they publish the regulations that we're going to be asked to vote on next week. And obviously we'll have to see whether it's adequate. You referred to the lockdown period. The reason why I voted against the government then, which was only the second time I've done that in my entire 15 years in Parliament, was because they didn't substantiate the claims that were made, for example, about hospital capacity across the country. They made claims and then they didn't supply the information, and I simply wasn't persuaded. I'm open to persuasion, but I think the onus is on the government, if it's proposing what are draconian measures, to bring forward the evidence, what's been underpinning their decision, and set that out. And I think that's quite a reasonable thing to ask.
And this is the crucial thing. I'm often told by people on social media, like, oh, well, what's your evidence that lockdowns don't work? I go, well, no, I don't have to provide that evidence. If you're shutting down the economy, you have to provide the evidence. It's the other way around. I mean, actually, the evidence is very clear. Look, the reality is, if the government hasn't done a detailed cost-benefit analysis of how each individual measure, whether it's the 10 p.m. or 11 p.m. curfew, or closing pubs that don't serve substantial meals, or opening non-essential shops, whatever the measure is, if they have not done a detailed cost-benefit analysis of the effects of this, frankly, they should all be taken out and shot, because this is a basic job of government. Ian Duncan-Smith served as Work and Pensions Secretary in the Tory government for many years. He pointed out this was routinely done for any small policy. The idea you would do it for a major policy that cost billions of pounds and you just let that go ahead without any policy and assessment would be insane. If they have done it, why are they not publishing it? Because surely, if the evidence is really clear that we will save many, many more lives and that the cost is worth it, we would all sign up to it, would we not? But clearly they're not publishing it, if it does exist, because it doesn't actually tell us what they want it to say.
Well, I mean, you might think that, and I couldn't possibly comment. But
you are a loyal Tory MP.
But that may be the case. And in fact, one thing that we have had published, Julia, just yesterday in the OBR forecast, the Chancellor adopted the central forecast, and it's interesting to look at the assumptions behind that. That forecast assumes Test and trace continues to not work particularly well. It assumes that the whole country will be in very severe restrictions all the way through until April. And it also suggests that the vaccines will not be widely available until the summer. And those are not things that ministers are saying as they're trying to persuade us to vote for the restrictions. So all I'm asking for, which I think is a very reasonable ask, is some straight answers to some straight questions. And as you've said, if the government's got a good case and can substantiate all of these things, then I would support it. But I'm waiting to see that information, as are a number of colleagues, and then we'll make our decision ahead of the vote next week.
I mean, we did see last time around the vote against the lockdown, it was 34 Tory MPs and another 4 MPs who voted against it, and then a number of MPs, I think it was 12, including Theresa May, the former Prime Minister, who decided to abstain. You are expecting, obviously, a lot more MPs on your side. You've got 70 in your group, and we know a lot of those people joined after being, I think, as horrified as a lot of us were by the Prime Minister announcing on that hasty press conference on that Saturday night before we went into lockdown, this possibility, this prediction of 4,000 deaths a day. An absolutely nonsense forecast, already had been overtaken by 2 subsequent forecasts far, far lower, debunked within hours as soon as any other experts had a look at that. And the fact that we were given that sort of information, false information, there's no way in the world that Chris Whitty and Patrick Vance didn't know that information was a complete load of nonsense. And yet we were told that. That has really undermined trust in the government, hasn't it?
Well, I think it has. I think colleagues are not prepared just to take things at face value. And on behalf of our constituents, we've got to tell people that we're confident that the decisions that are being taken are correct. And if I'm looking, a business owner in the face whose business is going to no longer be viable, or someone who's lost their job, I want to be able to tell them, it's not going to necessarily make them feel any better, but I want to be able to tell them that if that was as a consequence of a decision I took, that I had all the information in front of me, I weighed it up, and that was the decision I came to. And that's all I'm asking for. Give us the information and let us make those sensible decisions. And if the decisions are clear and well supported by the evidence, then I don't think the government's got anything to fear by publishing it.
Indeed. And just the next battle ahead is, of course, which tier large parts of the country fall into. Tier 1, I mean, again, I think we're supposed to be grateful for being in Tier 1. Very few parts of the country likely to be there. That's where the rule of 6, meeting indoors or outdoors, but still got the 11 p.m. curfew on pubs and restaurants. And but, non-essential shops, as will every tier allow, and hairdressing and things to be open. Tier 2, high alert. Most of the country, we think, will be in that. No household mixing indoors, rule of 6, outdoors, pubs and restaurants shut at 11 p.m. Those that are allowed to open who serve meals. Tier 3 is the big fear, isn't it? And it's thought that possibly Greater Manchester could be in Tier 3. And this is where no household mixing indoors or outdoors in venues at all, because pubs and restaurants closed except for delivery and takeaway. That is going to be the death knell for huge numbers of hospitality pubs and restaurants, hotels and otherwise, if that goes ahead. The big battle has been keeping many of the cities out of that. I know London, Liverpool, hopeful of being in Tier 2, but what do you think is going to happen?
Well, I think the government's been very clear that it's signalled that most of the country will be in tiers 2 and 3. That's the assumption that it's assumed in the forecast that we saw yesterday. But I think, Julia, one of the interesting things, even in tier 2, although pubs and restaurants can open and serve alcohol if they're serving a substantial meal, the problem they've got is that you can't mix with any other household indoors. Yeah. And I was listening to a report this morning from the industry that suggests that means in a tier 2 area, 75% of hospitality venues simply won't be profitable. And, that is going to potentially lead to hundreds of thousands of job losses. Yeah. Which is going to have consequences from years to come. Now, what I want to know is if that's the economic cost, I need to know that the benefit to having that restriction on the virus is substantial enough to justify that cost. And that's really the information that we're asking for from the government.
Indeed, as many are pointing out, people would be safer mixing in a pub or a restaurant with social distancing and good ventilation and the like, rather than meeting in their homes. Mark Harper, thank you very much indeed, Chair of the COVID Recovery Group, Tory MP, former Chief Whip as well.